Waterborne diseases are the leading cause of absenteeism in schools globally. Without proper hygiene education and sanitation, children's health outcomes, their ability to thrive in their communities, and their ability to learn can be compromised. We conducted a Washed Up in Schools trial to evaluate whether a multi-component teacher-led wash intervention can effectively improve the knowledge, perceptions, and the hand hygiene behaviors of children and teachers across primary schools in Lagos State, Nigeria. This evidence is urgently needed to influence policy changes regarding school wash curriculum and to influence hygiene practices of wider families and communities. This study was conducted by the New Child Initiative for Africa in partnership with Royal Society for Tropical Medicine and Hygiene, National Institute for Health and Social Care Research, and NIMA.
This was a CLT study conducted among 50 primary schools in Lagos, Nigeria. Approximately 3,500 pupils aged 5 to 12 years were selected for this study using the multi-stage sampling. Data was collected at the baseline before intervention, 2 weeks after intervention, and 3 months later after intervention through survey tools, school records, and focus group discussion with teachers. Selected based on inclusion criteria such as low-cost primary schools, presence of water, presence of functional hand washing facility, and also they must not have received a wash intervention before. Pupils were assessed based on their socio-demographic characteristics, illness behavior, sanitation behavior, knowledge of hand washing, and also their presence in schools. Quantitative data collected was analyzed using the SPSS software, while quantitative data collected was analyzed using the in vivo software. After completion of the study, all control schools received the wash-stop intervention.
This intervention is a teacher-led school-based Wash-Stop campaign. Wash-Stop stands for Water, Sanitation and Hygiene Education against Diarrhoea, Undernutrition and Pneumonia. And this program is aimed at promoting hygiene and sanitation practices among school children in the primary schools of Lagos State, Nigeria. It is a multi-component intervention that comprises of teacher training exercises, step-down trainings, provision of IEC materials. IEC materials are information, education, and communication materials. We also had the provision of hygiene kits, and lastly, establishment of wash clubs in the participating schools. For the teacher training exercises conducted, we were able to bring together all the intervention schools, and we were able to increase their capacity on hand washing demonstration exercises, other sanitation hygiene practices, menstrual hygiene, as well as provision of manuals on the knowledge of what we have been able to train them with. Step-down trainings were also conducted in the various schools by our health educators to intensify the efforts that were earlier done in the teacher training workshops. We were also able to provide this IEC materials so that the children can see and learn. For some schools, we were able to provide them with hygiene kits, and that's because most of them lacked the hand washing material that they needed in performing these exercises. Lastly, we were able to establish wash clubs in the participative schools by empowering the children on how to become hygiene champions and also to promote positive behavioral change.
The wash-stop in schools has shown that there's been an increase in knowledge among these children, increase in knowledge of hand washing, its perception, sanitary practices among the children and the teachers. And beyond this trial, we've even seen a reduction in infection rates, evidenced by a reduction in school absenteeism. So we are seeing less of diarrhea and pneumonia among these school-age children. Also, the feedback from teachers have also, encouraged and supported the washed up in schools. So parents are saying that there's been an improved knowledge of hand washing practices among their children. Even teachers are also saying there's an improved knowledge of hand washing among their children. A very important feedback we got from the school administrators and the teachers was the establishment of washed up clubs in schools. So the students are excited. They've established washed up clubs which are championed by the teachers and the students. The students are excited, promoting hand washing practices, promoting good perception, good sanitary practices in schools, and they are doing this by, having regular meetings, weekly meetings, where they sing songs that would foster the establishment of, wash in schools, and this is very important to us.
M&E is an integral part of capacity building. And with this, I have learned specifically on how to measure collected data, the usage of this data, and also to identify challenges regarding this project, and also how to mitigate the risk in order to produce a desired outcome.
Beyond the immediate impact of the Washed Up project and the teachers and students, it has also significantly contributed to the capacity building and development of the team members. As the assistant project lead, I can for sure say I've been able to earn skills that went beyond the scope of the project. Skills in stakeholder engagement, leadership skills, project management, resources management, and then I also was able to develop on my writing and reporting skills. But the Washed Up project did not just impact on the communities that we served, but it also in turn empowered we, the team members of the team, the skills and confidence to take on future challenges.
As a participant in the Washed Up in School project, I've been a beneficiary, and the school where I teach, the pupils have really been impacted in that now they know how to use the toilet better, they know how to wash their hands properly in the right way, and they know the time they should wash their hands before they eat, after eating, after the use of toilet, after playing, and when they return from school. The parents have even come to testify that they wash their hands properly and in a better way, and they even teach them to.
As a participant of the Washed Up program, I like to testify that it's a welcome idea. It really helped in my school because my children now know how to take care of their hands, their environment, very importantly, and even the teachers are not left behind. It's a very welcome program. We really thank the organizer. God bless you.
We're currently disseminating our findings with our local, state, and international stakeholders through organization of workshops and meetings so that the intervention can be scaled up appropriately. I'd like to say a big thank you to our funders, partners, participants, and volunteers for all their support. Go away, off my hands, now I say, do it now.